Ultrasound imaging has been useful because it's very easy, it's comfortable, of course, whereas electrodiagnostics cannot be very, comfortable for a patient to go through. And so you don't routinely do sort of serial measurements. But with ultrasound imaging, that's very easy to do. So once we're past the examination, the diagnostic side, maybe we're using it to guide some interventions, but we can also evaluate some tissue changes, for example, that may be occurring in areas that we're affecting, hopefully favorably, through manual therapies and other interventions.
Imagine performing a procedure with absolute precision, seeing exactly where your treatment is going instead of guessing. Dr. Nathan Savage, assistant professor at Winston-Salem State University, is an expert in orthopedic and clinical electrophysiology. He's pioneering how physical therapists use ultrasound imaging to guide dry needling interventions with unmatched accuracy. We dive into what that actually means for practice on this episode of Ortho Static. Nathan, welcome to the podcast. We appreciate your time, man. Thanks so much for hanging with us.
Yeah, well, thanks for having me.
I like to start with big picture. So let's go big picture first. Why do you believe point of care ultrasound imaging is a game changer for guiding manual physical therapy and dry needling interventions in the profession? Why do you believe it's just game changing?
Yeah, I mean, I think you can even start with just the use of point of care ultrasound imaging in general. We've certainly had the conversation of its role and value in especially orthopedic and neurologic related practices for physical therapists. It's an imaging modality that, of course, as the name implies, being point of care, you're right there bedside. It's a very natural extension in the hands of a physical therapist who already has a good skill set in examination and evaluation. The ultrasound imaging can extend that both on the examination, the sort of diagnostic side, and then as this conversation is about, some of the more specific applications that guide interventions. We presented, and we'll talk a little bit about dry needling interventions. There's a number of physical therapists that utilize dry needling along with their other manual techniques. And ultrasound imaging allows us to visualize in real time the targets that we're going for, which, in some applications that are going to be near nerves or blood vessels or around tendons or where the target is rather small. That is a game changer that allows us to see what we're doing more clearly and guide that intervention. And by the way, it allows us to track the progress of some of those soft tissue changes over time. So it gives a nice objective measurement to pair with those interventions in our evaluation of how that may impact patient care.
All right, so let's go a little zoom in a little bit. For clinicians who are familiar maybe with dry needling, but new to ultrasound guidance, how does incorporating ultrasound transform the effectiveness or safety of those procedures?
Yeah, I mean, again, if those that have used ultrasound and done dry needling or needling interventions with it, in my practice, sometimes we're guiding an EMG needle. And then other times for interventions, we're guiding a dry needle. So fairly similar in size. The MG needle is a little bit larger, but it really comes down to accuracy and safety. So if we're targeting certain in the area of certain neurovascular structures, or we just need a portion of a specific insertion point of a tendon or a specific region of a muscle, right? A lot of, for example, medial gastroc injuries and strains occur in a fairly specific region, and that may only be a matter of a few millimeters or maybe several millimeters, but still a fairly small target. And it is eye-opening for those that have done dry needling and then done it with guidance for some of these structures or deeper lying structures, how inaccurate we often are, that we think we may be in an area. If we're targeting, for example, a lateral hip tendon, for these patients, those can be deeper lying in a number of patients. With guidance, you can tell when you begin to insert that needle and you think you're directing it where you should be, how often we're not very close. We're off a significant amount from our intended target if we're looking at the pathology that we're hopefully directing our needling intervention. Other instances, like some trigger points and superficial structures and muscles, guidance may not be as big a deal. But a variety of structures that we go for in the foot, in the elbow, If we want to be more precise and be near the radial collateral ligament, for example, in the lateral elbow and not just in the common extensor tendon, guidance can be rather beneficial and can be essential to hit that target.
Yeah, you mentioned a few of those, but if you were to maybe list a few of the most common conditions where ultrasound guided dry needling can make a significant difference in outcomes, what else comes to mind? You mentioned a few.
Yeah, and outcomes, I don't know that we have the literature on some of these. We certainly can marry it with some of the injection literature and how effective the change in effectiveness of certain injection procedures are. Some of this is still ongoing, I would say, on the evidence of, hey, are we significantly better in outcomes if we guide in, say, lateral elbow? But if we think of some of the main structures that I would have used clinically and that maybe a number of clinicians do, I would talk about lateral elbow structures. And that can include the insertion point of, say, your common extensor tendon, your radial collateral ligament region. Sometimes when we're trying to target around, for example, the heads of the supinator muscle, and of course we have a nerve, the posterior interosseous is going to travel between those heads. That's an area that if we're in there, it's nice to visualize so that we can avoid some of the structures that we don't want to hit and we can target the ones that we do. Plantar foot is another one. Plantar fascial insertional problems, and if we need to target deeper. So sometimes it is just the plantar fascial insertion on the calcaneus. Other times there may be some of the deeper lying muscles, some of those more intrinsic foot muscles that are deep to the plantar fascia that we want to target as well. And being able to visualize both on the diagnostic and intervention side can be rather helpful. I would say lateral hip tendons is another one. Ultrasound being quite useful for helping us to differentiate. For example, are we just lateral hip tendinopathies? Do we have some sort of IT band dysfunction or pathologic change that's associated? And if it is those deeper lying structures, to be able to hit that target, again, is surprisingly difficult when we do it blind. So having the guidance, having the visualization is really going to be useful, not only for the experienced clinician and practitioner, but you can imagine when you're earlier on, to give that sort of added layer of comfort and safety for a novice examiner that may be newer to dry needling techniques. If they can see it, it's not that difficult to learn the technique of guiding these procedures. But to be able to see it will give you a lot more confidence if you're concerned about some of the neurovasculature in the area, and can help you refine your technique and even improve your technique with or without guidance.
Now, every innovation comes with challenges. There's a trade-off there. What are some of the barriers or maybe limitations clinicians might face when implementing ultrasound-guided dry needling into practice if they're listening?
Yeah, I mean, that it's fundamentally going to be getting training and getting experience with ultrasound imaging on its own. I mean, once you've gained experience with what tissues look like, how they move, you're familiar with the area, to add in the interventional side is not such a big leap once you're familiar with it. There is a little bit of handling often. I mean, there are some needling techniques where there's like guidance tubes and that sort of thing, but even some of my physician colleagues that do injection procedures often just do them like we would needling. You're just kind of manual. You're just, hands are free. You've got the transducer on one side. So you do have to control those variables. Of course, the basic things like you would with needling anyway, prepping that patient, prepping the skin, using gel that is not going to transfer any infection. But the technique itself, there's just a little bit of a learning curve. Once you're good with ultrasound, now getting the appropriate transducer and being able to localize that needle and track it as you perform your intervention. But I would say the biggest barrier is just getting your foot in the door and doing point of care ultrasound imaging, getting the equipment, getting familiar with it. The good news is there's a lot of handheld devices that are very affordable. I mean, there's a lot of folks that can get into a device for $3,000, $4,000, $5,000 that's brand new, that's handheld, very easy. There's of course machines that can be more expensive depending on what your needs are in your practice. But for a reasonable investment, you can get started and then just go get some of the training. There's a variety of training courses out there. We're trying to expand the availability of more physical therapist, taught courses and more physical therapy oriented courses. And there are already some out there, and including some that do needle guidance. So that's going to be the biggest piece. Once you do that, it's not a big deal to add the interventional side and the guidance side to your practice.
Great. Now, looking ahead, How do you see ultrasound guided interventions evolving in physical therapy, and what advice might you give to therapists interested in to adopting this technology outside of, hey, go get started and try it?
Yeah, I mean that's some of it. That's some of it. What I see happening is we're continuing, or I guess continuing the progress that has been begun of late. You're starting to see in the literature much more often interest in physical therapists performing ultrasound imaging, principally folks in the orthopedic, sports medicine, and maybe neurologic practice realm. You get some pelvic health specialties. There are some physios that we've met that are doing things in the lung. And blood. There's a number of applications that we're seeing. Job one is that needs to continue to grow in our profession, that folks are getting exposure to this in their entry level training. And if not, then when they get out into practice, they're finding the courses, they're learning to do it, and they're incorporating it. The interventional side is just an extension of that process. You've learned to do it diagnostically. You've learned to extend your examination skills with ultrasound imaging when that's appropriate. It's nice, it's inexpensive, it's safe. It's beautifully done in the hands of a physical therapist who already has great manual skills and evaluation skills to examine these patients with neuromusculoskeletal related conditions. The interventional side is just a nice add-on. It's a nice, at least in my practice, when I'm now principally full-time, academia and teaching and exposing my students to these kinds of things. But when I was in clinical practice, we would get paid for both the diagnostic side along with the interventional side. I think we paused there for a minute. Did I lose you?
Oh, got you back now. Perfect. No, I could hear you. Last
There we
question
go.
I'll ask
I'll
before we
start with
look
it,
for your
but
words of wisdom. Can you still hear me?
yeah. Yep.
Can you hear me okay? Yeah, I think it's a little bit delayed.
Yeah.
I'm trying to fix that. You've been board certified in both orthopedics and clinical electrophysiology, which is pretty rare, and are registered in musculoskeletal sonography. How have those different specialties helped shape your perspective on integrating technology into manual therapy?
Yeah, that's a great question. I mean, I would say integrating, those technologies on the manual side probably plays a larger role in folks that do ultrasound, evaluations, ultrasound imaging in their practice. Having those technologies are certainly just very good extensions of our clinical examination skills as physical therapists. It allows us to expand and answer some questions that sometimes are left unanswered based on our clinical examination, because we just have a little bit more depth and objective measurements that can maybe fill in the gaps. And that's one very important piece to both of those point of care diagnostics. Ultrasound imaging has been useful because, again, it's very easy, it's comfortable, of course, whereas electrodiagnostics cannot be very comfortable for a patient to go through. And so you don't routinely do sort of serial measurements. But with ultrasound imaging, that's very easy to do. So once we're past the examination, the diagnostic side, maybe we're using it to guide some interventions, but we can also evaluate some tissue changes, for example, that may be occurring in areas that we're affecting, hopefully favorably, through manual therapies and other interventions. So I would say ultrasound informs that piece a little bit better. From the research side, we've just finished up a study and I've submitted the manuscript on using ultrasound imaging to measure kinematics of the spine following manual therapy interventions that we use clinically. So in that realm, it does help inform some of our practice patterns, right? Hopefully, it's going to give us information about what we're doing, like the effects of what we're doing, and potentially how they may differ to help optimize on the clinical side. Even for clinicians that don't use ultrasound imaging, we can use that modality to help inform some of these techniques that we're otherwise going to be using in clinical practice with or without ultrasound. So that piece has been useful. I would say that the most powerful aspect of both of those, as you mentioned, electrodiagnostics, ultrasound imaging for a physical therapist, is number one, they really just help strengthen our examination and evaluation of patients. So for improving our diagnostic skills, for potentially improving the precision of not only the diagnosis, but interventional side when we're talking about guidance and tracking progress over time. That's been very useful. And for most existing physical therapists and those getting trained, ultrasound imaging is I would say, a lot easier to get involved with. It's less expensive. The training doesn't seem to be as long to really become fairly proficient in a reasonably or relatively short period of time, a matter of months rather than maybe multiple years.
If someone was looking to go somewhere and find out a little bit more, maybe they're nodding along here as we talk, where would you send them? Where are like good places to go and sort of dip their toe into learning about this?
Yeah, absolutely. Our imaging special interest group attached with the Academy of Orthopedic Physical Therapy has great resources for those that are interested in getting trained. I think recently I had just signed up for one of the mentorship programs or things they offer there, where you can at least list if you're trained in these kinds of things, and in particular in ultrasound imaging, that folks who want to reach out can get that resource. So our professional organizations have great resources and places to point you. There are some, I know Rocky Mountain University offers some courses in ultrasound and electrodiagnostics. There's a lot of physician-based courses. John Jacobson's a name that you hear a lot if you're looking into literature for ultrasound. If you're looking at training courses, you'll see some of those. That's some of the early courses that I did. But we are starting to see, a lot more physical therapy-driven training options, which are nice because, you go to a physician course and they're going to have the ultrasound basics, but they're also going to have a lot of injection-related guidance discussion, whereas we're not doing injection. So it's nice to have the physical therapist perspective on how you use it, both on the diagnostic and interventional side. But I would say our imaging SIG is a great place. The Academy of Orthopedic Physical Therapy is great. And our professional publications and sites are great as well, because we're, again, starting to see much more published in this realm. We've published a few papers in JOSPT. Others have done the same. You're starting to see this grow and grow rapidly in our profession, and I'm excited to see that.
Nathan, last thing we do on the show is called Words of Wisdom. What's the last thing you want to leave with the audience in terms of a parting thought or idea you want them to hold on to?
Yeah, I would just reinforce the points in our conversation that these point of care diagnostics and this conversation is about ultrasound imaging. These are valuable tools that physical therapists need, that are in those practices, orthopedic, sports med, maybe in the neuro side. They really need to be engaged and motivated to incorporate these in their practice from both the diagnostic and interventional side. And it's a great benefit. In most of the states, we're able to get good reimbursement on these. We can also get reimbursement for general guidance codes. We did both of those when I was in clinical practice. But either way, that helps our profession move forward, particularly in the context of primary care providers and advanced practice providers, which is very much what physical therapy has become.
Nathan Savage, appreciate your time and your insight on this here on the AOPT podcast, Ortho Static.
Well, thanks for your time. I enjoyed coming.